Hi dear followers and our patients. Today we are going to have a brief about how to do the wash after the beard and mustache transplant. There are some basic rules applied to the hair transplant, beard transplant and eyebrow transplant, but there are also some exceptions and different points. When we talk about the facial hair transplant, it means beard, mustache and eyebrow transplant, there are some similar rules. Number one, the first wash after the beard and mustache transplant should be done next day after the surgery. That's one of the biggest differences we may see compared to the hair transplant surgery. First thing you have to do, we need to remove the bandage. Do it very gently from the corner, because the bandage can get stuck to the back of the head. Do it very gently. You may have some sore feeling or some burning sensation. Gently remove the bandage from back of the head. One more point is that it's not an obligatory to remove the bandage from back of the head. You can remove it on the second day after the surgery. The first thing we do is that you have two bottles in your hair care. Number one, it's the lotion, and number two is the shampoo. We'll use them separately. The first thing we do is that you apply some lotion over the transplanted area. You can apply it directly over the skin, or you can grab it some on your hand and tap over the transplanted area. The golden rule here, no rubbing. Do gentle tapping. That should be the direction how this lotion is applied. The lotion is needed to make the scabs on the face softer, so during the wash they won't bleed. It looks just like you applied the foam when you have to shave your beard. After you applied the foam or the lotion, let it wait there for like 3 to 5 minutes at max. 3 to 5 minutes, we have to rinse off the lotion. How you're gonna do it? At home, you have the shower header. When you switch it one side, it gives you running water. When you switch it the other side, it gives you a dispersed water with the high pressure. We don't need the high pressure, we need the low pressure warm water, okay? What you do is just gently rinse it off. Use your hand as a barrier so the pressure will not be too high. To make this process even easier, you can use a bowl to do the wash. Okay, raise it a little bit, now wait please. And after that, you have the shampoo in your bag. It's a combination of the lotion, first to soften the scabs, and number two, the shampoo. It's also foamy, so it's much more easy to apply it. We get it. Again, what we do, we tap it over the transplanted area, making it softer. That's it. Never rub it. Just do gentle tapping over transplanted area. When doing it, you can look on the mirror so you can much more easily apply it. And the same for the other side of the face. Don't forget, no rubbing, no massage, just gentle tapping, like you slap the buttock of the small baby. It shouldn't be very soft like this. It should be with the medium pressure, and your hand moving on the vertical plane. You can do the tapping for like 2 to 3 minutes to make it much more easier. And after that, lean forward please, gently again rinse off the foam. And the same for the other side. If you have too much bleeding spots, you can easily do it once or twice. You can wash your beard and mustache transplanted area up to 2 times a day with no problems, because the facial hair heals much more faster. It will be much more better and easier for you. How to dry the face? We should do it with the paper towel. Get the paper towel and gently push it over your face. Do not rub it. And the same for the other part of your face. Grab some water over your hand or over the cap and gently tap it with the running water. And again, do not forget, you should tap it. You should not be rubbing it or do any circle moves across the face. With the paper towel, gently apply it over the transplanted area. You may see some blood clots or some tissue remnants over the paper towel, but you shouldn't be seeing any grafts. That's how the wash is done. As we have mentioned before, you should do it once, at least once, but up to 2 times a day. You don't have to remove your bandage first day after the surgery, but if during the wash it becomes wet, that was the reason we removed it actually, you can remove it and you may not need it anymore. But our advice is to keep for 2 days, and second day before your second wash actually, you can remove it. During the wash for the donor area, the rule is slightly different. You can rub, you should actually rub and gently massage the back of the head. It will remove dead tissues from back of the head. It will help to increase the blood flow and promote the healing even faster. When the wash for the back of the head is done, you may have some soreness or pain during the wash. It's normal, but you should continue with this one. At the end of the wash, for the donor area only, please use an antibiotic cream that's provided within your first aid bag. With a thin layer, please apply it over the donor area and gently rub it into it. It's an antibiotic cream with the low dose of steroids inside. It will decrease that itchy feeling and decrease inflammation. And also, antibiotic inside it will prevent any infection to the donor area as well. It should be a thin layer that is applied very gently and with circular motions to the back of your head. That's it. Thanks for watching and good luck.